Hi, my name's Erica and I'll be your student nurse today. Today I will be inserting an IV infusion. So the first thing I would do is I would walk into the room and wash my hands. I would ask the patient to state their name and date of birth, and I would assess for any allergies. If there was no allergies, then I would be good to continue. I would then assess the patient for any skin turgor, any edema. I would assess their blood pressure, LOC, and their weight. I would then go ahead and explain to the patient what I'm doing. So again, I am inserting an IV infusion. I would explain to them as to why I'm doing that. So for example, if they are dehydrated, they would need it for IV fluids. I would go ahead and make them comfortable by placing a pillow underneath their arm. Once I decided on a site, I would assess that site for any redness, swelling, bruises, bumps, or any skin breakdown, and if there was none of that, then I would be able to go ahead and continue with that site. So I would put on my gloves, since I already washed my hands in the beginning as I entered the room, and I would open up my IV start kit. And then I would take off a piece of tape, which I already did, and I have it here on the table. And then I would open up my stat lock. And then I have my needle here. And I have my PosiFlow and my J-loop. So I would open up my J-loop and I would keep it halfway closed so I'm able to keep it sterile. And then I would open up my PosiFlow. I would take my PosiFlow and attach it to my J-loop. And then I'm just going to take this side off. Then I'm going to take my normal saline and attach it there. And I would make sure my clamp's open and I would just push in to prime it. Once I see the normal saline, I'm just going to clamp my J-loop and keep it in its package. And then I would, now that I have this all set up, I would come back to my patient and I would apply my tourniquet. And I would just palpate to find a good vein to use. And I'm going to use this one right there. So I would undo my tourniquet for now. And I would take my chlorhexidine and I would crack it open and I would apply it for 30 seconds using friction. And then I would let that dry. And then once that is dry, I am going to reattach my tourniquet, or put on my tourniquet again. I would take my needle, which I am using a 22 gauge. Gonna hold it bevel side up. I'm just gonna pull back a little bit and insert, and then check for blood return. I'm going to lower my angle a little bit and continue to push forward and pull out the needle at the same time. Then applying pressure. Quick attach that, open that. I would aspirate to look for blood return. I have blood return. So since there is blood in the normal saline, I'm just going to go ahead and push it all in. And then I'm just going to clamp that and take my normal saline off. I would then go ahead and take my skin prep. First, before applying my skin prep, I would just take some gauze and clean up around the area if it's leaking or if I got blood anywhere, just so I can make it dry to put the skin prep on. And then I would apply the skin prep to both sides. I would take the steri strip, making sure the arrows are facing the patient. Put that on. Apply that. And then I would take my gloves off, wash my hands, and I would document where I put in the site, if I got blood return, if there was any redness or swelling at the site afterwards, and I would document that I clamped it. I would take my gloves off and wash my hands, and then I would have taken off the tourniquet after I had the needle in, and I saw that I had blood return.